Hello, gentlemen, on the Vital Men 60 channel. At the age of 60, sexual and penile issues are common. But don't worry, understanding them helps you gain better control. Erectile dysfunction, ED, affects 52 to 57% of men over 60, according to Frontiers in Endocrinology 2025, due to reduced blood flow, low testosterone, and decreased nitric oxide, making it harder to maintain erections. The penis also changes. It requires more direct stimulation to get erect, may curve due to scar tissue buildup. Peyronie's disease becomes less sensitive and slightly decreases in size due to tissue aging, according to WebMD and The Conversation, 2024 to 2023. Sexual desire declines in 12 to 51.6% of cases, according to HIMSS 2025, but most men maintain some libido until age 70 if healthy. These changes may cause insecurity, but the good news is that Kegel exercises, healthy eating, and hormone checkups can help. See your doctor for personalized advice. Age 60 is not the end. Take action to keep your sexual vitality alive. If you find this video helpful, like, share, and subscribe to the Vital Men 60 channel to get more reproductive health advice. Thank you for watching. Common health issues in men over 60, prostate health, understanding BPH, and prostate cancer. Hello, gentlemen, on the Vital Men 60 channel. I am Dr. James Edward Carter, here to chat about prostate health in a way that's clear, supportive, and based on the latest science. As men cross into their 60s and beyond, the prostate gland, that walnut-sized powerhouse below the bladder, can start causing some real concerns. It's involved in everything from urination to sexual function, and issues like benign prostatic hyperplasia, BPH, and prostate cancer become more common. I know this can feel overwhelming or even scary. After all, it's a sensitive area, but understanding it empowers you to take charge. In my experience, helping folks like you, early awareness often leads to better outcomes and less stress. Today, we'll dive deep into BPH, non-cancerous enlargement of the prostate, and prostate cancer, two of the most prevalent issues for men over 60. We'll cover definitions, symptoms, causes, risk factors, diagnosis, treatments, and prevention, all backed by credible 2025 research from sources like the Mayo Clinic, Johns Hopkins, and global studies. I'll sprinkle in specific statistics, real-world examples, and my personal opinions with practical advice to make this relatable and actionable. Remember, I'm not your doctor. This is info to guide conversations with your healthcare provider. If you're experiencing symptoms, please see a professional right away. Let's get started. Section 1. The prostate gland. A quick overview. Before we tackle BPH and cancer, let's understand the prostate. This gland surrounds the urethra, the tube carrying urine from the bladder, and produces fluid that nourishes sperm. In younger men, it's about the size of a walnut, but as you age, it often grows. By age 60, many men notice changes due to hormonal shifts, inflammation, or genetics. According to a 2025 review in the Journal of Urology, over 50% of men in their 60s experience some prostate-related symptoms, rising to 80 to 90% by age 80. These aren't always serious, but ignoring them can lead to complications like urinary tract infections or kidney issues. In my opinion, the prostate is like a car's engine. It runs fine for years, but regular checkups prevent breakdowns. For instance, a patient I advised in his 60s caught early changes through a simple PSA test, avoiding bigger problems down the road. Now, let's focus on BPH, the most common non-cancerous issue. Section 2. Benign prostatic hyperplasia, BPH. The non-cancerous enlargement, BPH, or benign prostatic hyperplasia, is when the prostate grows larger without being cancerous. It's not life-threatening, but it can squeeze the urethra, causing urinary problems that disrupt daily life. Think of it as a balloon inflating inside a narrow tube. Eventually, flow gets restricted. 2.1. Prevalence and statistics. BPH is incredibly common in older men. A 2025 study from BMC Urology estimates that globally, 79 million men aged 60 and older had BPH in 2019, with prevalence rates climbing steadily. In the US, Yale Medicine reports that 50% of men aged 51 to 60 have BPH, jumping to 70% for those 60 to 69 and 80% over 70. A comprehensive 2025 analysis in Discover Public Health notes BPH affects 60% by age 60 and 80% by 80, with higher rates in Western countries due to diet and lifestyle. Globally, lifetime prevalence is around 26.2%, based on data from 25 countries, per Tropical Medicine and Health. In Asia, rates are lower, about 50 to 75% in men over 50, but rising with urbanization, as per a 2025 Translational Andrology and Urology study. These numbers show BPH isn't rare, it's almost expected. Personally, I think this underscores why routine checkups after 50 are crucial. Catching it early means simpler fixes. 2.2. Symptoms of BPH. Symptoms often start subtly, but worsen. Common ones include frequent urination, especially at night, nocturia, weak urine stream or dribbling, difficulty starting or stopping urination, feeling like the bladder isn't empty. In severe cases, urinary retention leading to infections. Johns Hopkins Medicine states symptoms appear in 1 in 4 men by age 55 and half by 75. A 2025 Ezra report echoes this, noting 50 to 90% prevalence by 70 to 80. For example, imagine waking up 3 to 4 times a night to pee. That's nocturia affecting sleep and energy. In my view, these symptoms can mimic other issues like infections, so don't self-diagnose. Get checked. 2.3. Causes and risk factors. BPH's exact cause isn't fully known, but hormones play a key role. As men age, testosterone converts to dihydrotestosterone, DHT, stimulating prostate growth. A 2025 StatPearls review links this to aging, with inflammation and metabolic syndrome accelerating it. Risk factors include age, primary driver, as per Harvard Health, 50% by 60, 90% by 85. Family history. Genetic links increase risk 2 to 3 times. Obesity and diabetes. A 2025 Aging U.S. study ties inflammation and lipid markers to BPH, especially in metabolic syndrome cases. Lifestyle. Poor diet, lack of exercise. In a global burden study from Nature, 2025, BPH cases rose due to aging populations, with higher disability-adjusted life years, DALYs, in developed nations. My advice, if you're overweight, losing 5 to 10% body weight can reduce symptoms. I've seen it help many. 2.4. Diagnosis of BPH. Diagnosis starts with a history and digital rectal exam, DRE. Tools include PSA blood test, elevated but not cancer-specific, urine flow tests, ultrasound or cystoscopy. NIDDK recommends these for accurate assessment. Personally, I suggest annual checkups after 50. It's quick and can rule out cancer. 2.5. Treatments for BPH. Options range from watchful waiting to surgery. Medications. Alpha blockers, relax muscles, or 5-AR-IS, shrink prostate. Cleveland Clinic Journal, 2024, updated 2025. Notes. Long-term 5-ARIs reduce surgery risk. AUA guidelines support this. Minimally invasive, aquablation, water jets, offers lasting relief with low side effects, per Harvard Health 2025. Mayo Clinic's heat-free ablation has 10% retrograde ejaculation risk. Surgery, TURP, or prostate artery embolization, Cedars-Sinai, 2024, improves quality of life dramatically. New therapies, a 50-year review in Nature, 2025, explores peptide analogs for BPH. European Urology, 2025, proposes first-line interventional therapy for faster relief. Houston Methodist, 2025, emphasizes tailoring to prostate size. My personal tip: start with lifestyle, drink less caffeine, do Kegels. If meds cause side effects like ED, switch options. A Springer Review, 2025, notes new treatments preserve sexual function better. 2.6. Prevention and lifestyle advice for BPH. Prevent BPH by maintaining weight, eating veggies, dark fruits, exercising. NIDDK studies show active lifestyles reduce risk. In my opinion, daily walks and tomato-rich diets, lycopene, help one patient cut symptoms by half this way. Now, shifting to the more serious concern, prostate cancer. Section 3. Prostate cancer, the leading cancer in older men. Prostate cancer occurs when cells in the gland grow uncontrollably. It's often slow-growing, but can spread. Unlike BPH, it's malignant and requires vigilant screening. 3.1. Prevalence and statistics. Prostate cancer is the second most common cancer in men globally. SEER data, 2025, shows an incidence of 120.2 per 100,000 men, with death rate 19.2. ACS projects 2,041,910 new U.S. cases in 2025, with 618,120 deaths overall, prostate being a top killer. Over 60% diagnoses are in men 65 plus, average age 66. Globally, 1.4 million new cases in 2020 per Frontiers, with ACIR 30.7 per 100,000. In 2022, over 1.4 million cases, prevalence to 5 million by 2027. African American men have 60% higher incidence and double mortality. A 2025 Nature study links smoking to severe burden in older men. Frontiers, 2025. Notes: steady rise since 1990. These stats highlight why screening matters. In my view, it's a game changer for survival. 3.2. Symptoms of prostate cancer. Early stages are asymptomatic, mimicking BPH, urinary issues, blood in urine, semen, ED, bone pain if spread. University of California, Davis, 2025, stresses advanced symptoms like back pain signal metastasis. Example: a 68-year-old with frequent urination thought it was BPH, but PSA revealed cancer. 3.3. Causes and risk factors. Age is key. Incidence rises after 50, sharply over 55. Other risks: family history, 2 to 3 times higher if father-brother affected. Race, higher in black men. Genetics, BRCA mutations. Lifestyle, smoking, obesity, per ACS. A 2025 Annals review on prevention highlights diet and exercise reduce risk. UC Davis notes hereditary factors, advocating testing. My advice: if family history, start screening at 45. It saved lives in cases I've reviewed. 3.4. Diagnosis and screening. PSA test and DRE are standard. USPSTF advises against routine screening over 70, but VHA data shows many continue, reducing mortality. EAU 2025. Study: avoiding screening raises death risk. Biopsy confirms. In Saudi Arabia, 2025, awareness is low per Springer. Personally, discuss PSA pros and cons with your doctor. Overdiagnosis is real, but early detection boosts 5-year survival to 98%. 3.5. Treatments for prostate cancer. Depends on stage. Active surveillance for low risk per News Medical 2025. High survival, 65% plus for higher risk. Surgery radiation, radical prostatectomy or brachytherapy. Hormone therapy for advanced. New, targeted therapies for metastatic per Harvard 2025. JAMA 2025 shows better survival in screened men over 70. A 2025 systematic review in advances in radiation oncology assesses outcomes in over 65s. My take, choose based on life expectancy. Surveillance for low risk avoids side effects like incontinence. 3.6. Prevention and lifestyle advice for prostate cancer. Reduce risk with diet, veggies, low fat, exercise, quit smoking. Penn State 2025 emphasizes age as factor, but screening saves lives. BMC Urology 2025 notes barriers like age myths hinder screening. Advice: eat broccoli, sulforaphane helps, stay active. One man I knew lowered risk through this. Section 4. Linking BPH and prostate cancer. What to watch for. BPH doesn't cause cancer, but symptoms overlap, so screening differentiates. A PMC study, 2020, updated, notes 3.5 million years lost to cancer in over 50s. In my opinion, treat BPH to improve life quality, but always screen for cancer. Section 5. Final thoughts and personal recommendations. Prostate issues in men over 60 are common, but manageable. With BPH affecting 70% plus and cancer incidence high, knowledge is power. My key advice: get annual PSA DRE from 50 to 70, maintain weight, eat well, exercise. If symptoms arise, don't delay. Early action changes everything. You're not alone. Talk to your doctor and stay positive. Feel better soon.